What is the major difference between a true evolutionary carnivore and a human who has evolved toward carnivore but is not there? What is the major difference? And why a carnivore diet is not a good idea for humans long term? Woo, there's the controversial statement.
It is a
Okay. It
controversial
is
statement.
I'll tell you this, it's an unsustainable diet. Pure carnivore is unsustainable from a health perspective long term for a human. It is the most effective elimination therapeutic diet to get rid of disease. So, in the therapeutic arm, for the first 2 to 4 years, it is the single best way to immediately get healthy because it's your best weapon against insulin resistance and maximizing nutrient intake. But the price you pay is hormonal disruption. And in my practice, I see a lot of folks who have extended a very tight carnivore period to the point where they are now suffering disease. And this is a very topical point because a study has just been published by our people that exposes what I'm saying. So, what is the problem with a carnivore diet in perpetuity? So, we've got a therapeutic phase, then we've got a sustainability phase for the rest of our lives. And in the first phase, in the therapeutic phase, carnivore is the best diet out there. But once you are pretty healthy, it is a poor diet to sustain optimal long-term health for one reason. Why? What's different about humans to carnivores?
So humans to carnivores, I'm thinking intestinal system. That's what
A
I'm.
little bit,
No?
a little bit, yes.
You're thinking endocrine system? I
Yeah.
don't know actually.
So
Yeah.
the difference is this. In pure carnivores, they've evolved whereby mostly amino acids, which are the breakdown products of protein, and fatty acids, the breakdown product of fat, trigger 100% of their insulin release and insulin production. So they do not need carbohydrates to produce insulin. 70 to 80% of human insulin release, human insulin production is released in response to a hormone called GLP-1. Everybody now knows what GLP-1 is. It's Ozempic, it's Mounjaro, it's those drugs, right? So GLP-1 is naturally made in the upper intestine and the lower intestine. And the human body is so beautiful, Claire. It is so beautiful. In the upper intestine, you've got a cluster of cells that secrete GLP-1 in a very high spike. And it exclusively releases GLP-1 in response to carbohydrates in the upper intestine, sugar and starch. And it's that release of GLP-1 that enters the portal venous blood system, goes to the liver, goes to the pancreas, and says it has to go systemically to the pancreas for the people that know anatomy, but that triggers insulin release. 70 to 80% of our insulin production comes because of carbohydrates. About 20 to 25% is released in response to amino acids. So we do have some release, like the carnivores, but the majority comes from sugar. At the bottom of our gut, in the distal, in the bottom small intestine, the GLP-1 primarily gets released in response to fat. And that GLP-1 then goes to our brain and creates the satiety that we get from fat. That is why on a high-fat diet, we don't feel like eating so often, we don't feel like eating so much. And the value of being in ketosis, in part, is not just about the fuel of the body, but it shuts down our appetite. So unless we're heavily addicted and stressed, we are going to eat less and less often because of that GLP-1 effect. If you're eating sugar all the time, you're spiking insulin, your blood sugars are doing this, you're going to be eating repetitively. And you're not triggering the fat-release GLP-1 that suppresses appetite. However, if you've been on a carnivore diet for a very long time, now your liver is still producing sugar from protein, gluconeogenesis, very good. But the muscle cells, which are the largest users and storers of glucose, liver is number 2, the muscle cells require insulin in humans. And the way that insulin gets triggered is from GLP-1 and carbohydrates. So in my long-term lean mass hyperresponder carnivores, they have too low an insulin. The phrase that I've coined for this is called insulin suppression. And when you are insulin suppressed, you're functioning like a type 1 diabetic. The type 1s don't have insulin to produce. The LMHRs don't produce insulin because they don't have the trigger. And now the sugar goes out to the muscles. It cannot get into the muscles. The muscles don't care because you fat adapted, they're using fat. But now you've got this rise of sugar in the bloodstream. And then the only way you can clear it is that sugar has to come back to the liver, and the liver can turn sugar into fat without the use of insulin. The receptor for sugar, the GLUT4 receptor, does not require insulin to get it. I'm speaking out of correction, it might be the GLUT3, but the receptor in the liver doesn't require insulin. So then the liver makes triglycerides. So if I look at my long-term fastidious carnivores, I start to see in women the testosterone going up. I start to see their triglycerides going up. I start to see their blood sugar going up. I start to see their A1C going up. Well, that's exactly what why I'm carnivore. I want to get away from the diabetes side. Well, it's the opposite side. It's a bell curve. So you've got insulin resistance and you've got insulin suppression. You want to be insulin sensitive, where you only need a small amount of insulin to do the job. But in order to do that as a human being, you need sugar. And Paul Saladino, a few other folks, found that they crashed and burned hormonally. Testosterone was low for a male. He felt terrible. His electrolyte regulation was off. And then he started to introduce progressively more sugar and corrected that. Now, it's overblown, in my opinion, the amount of sugar he's eating. But that is why, and I know this is, oh my God, how can you say this? Because I'm walking into the church of carnivores and telling them that it's not a good diet, but I'm basing that on my physiology and my science. Now, I love the carnivore diet. I am heavily carnivore based, like your husband. I think it is the optimal diet, but we do use some carbohydrate to trigger insulin, not as a fuel source, but to trigger insulin. Secondly, there's a woman by the name of Isabella Cooper that did a beautiful study. She's in Oxford, doing a PhD, working in the ketogenic space, published a paper I interviewed on my channel. Very high-end, nerd-out science discussion, but her cohort of women that she's studying are all fat-adapted, but they all consume between 50 and 75 up to 100 grams of carbohydrates a day to trigger insulin. No medication, perfect blood work, okay? And then the big noise, and this is where I'm a little bit annoyed, because we're starting to see spin in our own community in a heavy way to support a result that they didn't expect, that I fully predicted, from the lean mass hyperresponder study that's just been published. Okay. And our society, including myself, I paid money to support that. I sent patients to the study. They've got a large number of my patients in that study. So I love the study, but I already know that LDL doesn't cause heart disease. We know that categorically. This study was just another piece to affirm that. But what the study also demonstrated is exactly what I've just talked about. And yet you're going to see the spin, and they've already published spin papers, which is a problem for me, because the worst thing we can do is spin ourselves when we're blaming everybody else for spinning nutrition and diet, okay? They saw that there was really no difference on average in soft plaque formation in the lean mass hyperresponder population as a cohort versus people on a standard American diet. And they cannot spin that. They can't explain that with spin. So they're saying, oh, you've got plaque, you get more plaque. No, you've got a percentage of people on both sides of the spectrum. Standard American diet is insulin resistant. A lot of the LMHRs, including many of the patients I sent in there by criteria, are insulin suppressed, and they get worse over the 2 years of the study. Both of them, because of their elevated carbohydrate consumption, because of the elevated blood sugar, are going to get vascular inflammation, are going to see some soft plaque. There is a cohort of the LMHR population that are insulin resistant that are going to protect themselves because when triggered by amino acids, they can produce more insulin. A little sophisticated. But the explanation there is because a carnivore diet is not a lifelong sustainable diet. But if you believe it is, now we've got to spin the data. So that study proves what I've just said, is another piece in the armamentarium of what I've said. Carnivore, paradoxically, best therapeutic diet, by far. We are carnivore-based as a family, but my son gets a bottle of milk twice a day, and occasionally he gets some mixed vegetables, some carrots, some peas, some corn, to trigger insulin. He's fully in ketosis, he's fully fat adapted, but he's a growing boy, he needs insulin. We need insulin for cancer surveillance. We need it for mitochondrial repair. We need insulin for brain tissue repair. We need insulin for normal steroid hormone regulation as a female, as a male. We need insulin for electrolyte regulation. Insulin's a quarterback hormone, and if you don't have it, you're in trouble. And yet, we don't change our thought process.
Well, I've heard you say in many talks you changed your thought process. So I'm wondering, what changes have you had over the last few years? Were you much more pro carnivore at one stage, and have changed and adapted? And I do think this is really interesting. As you've said, talking balanced, nuanced, and evidence based around carnivore diet, because I think it's worrying to be evangelical about any diet, and I could potentially be out about ketosis and keto diet, because that's the diet that I came to low carb and nutrition around. It did wonders for my daughter's health, and then the whole family often in ketosis, and we love it. But is it for everybody? No, because there's not one size fits all.
Well,
So
I
I
am going to
think
disagree with you a little bit there. I think a keto or a fat-based diet as your primary macronutrient is the healthiest human diet. If you take the human body, you remove the water, which is about 70%, you remove the skeleton, the majority of what you've got left is fat, structural fat. We need structural fat. If that is made by the conversion of sugar to fat, it's a very poor quality fat. So I would disagree with you. A ketogenic diet is the healthiest diet for human beings.
I'm not saying it's not. I'm saying we don't need to be evangelical. So if I'm working with somebody and they don't want to go there, they're 5 layers above that standard American diet, I don't need to push them straight onto a keto diet or carnivore diet or anything. I mean, it could be we're talking swaps. We're talking swapping ultra processed foods for artificial sweetened sugars, which is something that I have done with clients, and making it clear that isn't, I don't think, a long-term approach, even a great stepping stone, but that's where people are at. So that's what I mean by evangelical. I certainly think it's an extremely beneficial diet for
absolutely.
brain
health.
Fat
as a component is important. The other thing that conflicts with this also is you've got to take into account the addiction element. And so there are certain types of sugar and starch that there's just no way I'll ever eat because it's a trigger for me. So I've got to get my carbohydrate trigger from something else that doesn't trigger me. And the ones that rarely trigger people are vegetables. So even the starchy vegetables. So instead of, from a dietary perspective, counting how much carbohydrate there is, the addiction process is binary. It's yes and no. So I can eat peas, but I don't eat ice cream. It's a binary approach that I use, because peas I'm not going to come home after a rough day, pile a plate up like this with peas and eat them for the emotional benefit. And from time to time, those carbohydrates have benefit to me to trigger insulin. Now, I'm heavily carnivore based, 95%, but I will include some forms of carbohydrate or of foods with carbohydrates in them. And I find dairy to be one of the best ones. Biggest issue with dairy is weight. But my son drinks whole milk with a bit of heavy cream in twice a day, particularly to trigger that. And then occasionally he'll get something that is enriched with some form of sugar. But that is primarily to trigger insulin.
And that leads me to talk about your own foods and your health story. You mentioned it at the very beginning of our chat that you've lost a great deal of weight, but you've been working in this industry as a doctor, as a surgeon for over 20 years, and your weight loss was over 20 years ago. And you're really a pioneer in finding carbohydrate reduction therapies and ketosis, and being very positive about the carnivore approach, and now talking about it as one of the therapeutic tools, which I think is a good place to place it, to be fair. Alongside, I would say, GAPS type diet, myself, with nutritional, nourishing traditional meats and foods and broths, and very, very, very low carbohydrate. But yeah, your own story of how did your health personally benefit, and then your family. What do you eat in a typical day?
Well, the first thing is I lost my weight 25 years ago. I've had a few struggles, like any addict. I've had some relapses, but I manage it pretty well. And am I perfect? No, no addict except those evangelists on the internet are perfect for a little while. Again, I put that out there a little bit skeptically, but I'm very honest about my own struggles and my own victories. As a family, we primarily are animal based, and it's more pragmatic than it is physiologic. I hate throwing out dead vegetables at the end of the week. My dog will eat leftover meat, but he won't eat leftover salad. So it's more a pragmatic way that we eat almost purely animal products at home, including dairy. When we go out, if I feel like a vegetable as just the enjoyment for the latitude of it, I'll eat a salad, I'll eat some vegetables. I don't have a problem with that whatsoever. The other key thing is we have a broad range of foods that we eat, macro, micro, and a diversity of animal products. There's no animal product that you should or shouldn't eat. And anybody tells you you must or you mustn't doesn't understand who you are. They're coming again from their own belief basis. The only thing that applies for me and my patients is whether we like something or not. My wife hates liver. I like liver. I'll eat it. Okay. I don't like bacon. She loves bacon. So again, that is a choice. But if the range is wide enough, we're okay. And this whole thing about demonizing dairy, the only three reasons not to use dairy is if you have a true allergy to milk protein, not to lactose. That's just an intolerance. That's a receptor recruitment. But it's a casein or a whey protein allergy, which is very rare. If you have, not, it's not very rare, but it's rare. It's actually one of the more common ones together with egg allergy. However, it's a protein allergy that is a real allergy, not measured by some allergy testing, where you have a true reaction. And oh, I got bloated when I drank milk. Yeah, but you haven't had it for 10 years. The second one is weight gain. And the third one is if you just don't like it. So, it's those are the reasons not to drink it. But all these, because all of nutrition in 1927 is based on the analysis of breast milk. Okay, so in 1927, there's this foundational study of the recommended RDAs is based on the analysis of what was in breast milk. Now, to the best of their ability in 1927, and that's where the RDA recommendations came from. So again, if you look back in history, most people don't know that. But now milk is great for babies, but terrible for adults. And you must drink skim milk and you mustn't drink whole fat milk. And all those recommendations have been distorted. Remember that dairy is the only product that all mammals cannot survive without. We die if we don't have it. And dairy is the exclusive product we use during a part of our lives when our growth velocity and our developmental velocity is the fastest it's ever going to be in our lives as babies. And yet, as soon as that first few months is gone, we demonize it. It's crazy. So that is a foundation for me is, okay, what's in dairy? How can I get that from the rest of my food? Vegetables are a part of my food, no fruit. No fruit. And the reason for no fruit is because I don't trust myself. There are blueberries in my fridge. I'm doing drive-bys, so they don't exist. Nuts are fine in my house. I don't do drive-bys with them, but if you do, that's a problem. So from a dietary perspective, I have to take my own situation into consideration, plus the nutrition of my family. And we are heavily carnivore based, like your husband. We'll have pure carnivore meals, but we have the latitude to trigger insulin. And I measure that in my blood work. So that's our diet at home, but it's wide ranging. Includes eggs, includes dairy, beef, lamb. We love lamb, chicken, poultry, fish, seafood. I love sardines. So sardines, canned oysters, that kind of thing. I love them. So that's how we roll in our house.
Yeah, I like the flexibility, and for me, the meat-based approach as well is very, 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 very convenient. Really quite simple meals to put together. And we had pork this evening with kangaroo, which was, which is probably something you can't get very easily over there. But yeah, and it's just whatever takes us. I really don't like to see a particular approach in a particular meal, a particular meat source, this is the only one, have it 5 times a week. I just, that's quite dogmatic, really. But also some people benefit from a very, short period of being extremely strict and repetitive, and for a number of reasons. So for a short time, that can work well for people. But I was going to get back to a topic we touched on about the future of well, I suppose nutrition, but just wider health with what's coming out of America at the moment, and just your view. There's lots of noise. You touched on earlier, red dyes coming out of foods, fluoride is being talked about, raw milk, and autism. There's going to be, around the time that this goes to air, actually, there's supposed to be an announcement about the root causes or the trigger points of autism, which is a topic I've heard you talk on in the past. So anything for us to look out for, or your thoughts on any of those topics?
Yeah, if you read the book Ketogenic, I wrote the chapter on autism. Very controversial because people don't think of it this way. And again, my pediatric surgery allows me to be qualified to talk about babies in that way. So that chapter is, in my opinion, still the defining root cause of autism spectrum disorder. I truly hope, and I'm on one of the task forces for a transformation in healthcare policy. However, I am not on the autism spectrum task force, and I truly hope that they're going to get it right, but I'm highly skeptical that they are. And I think they're going to blame the pimple on the elephant's butt, but not see the elephant. I truly hope that they look at fat in the human diet, especially post-weaning and in the mother's diet when she's pregnant. They look at gestational diabetes, and they look at elevated blood sugar and it's really insulin resistance is the cause of insulin resistance in a low-fat diet is the cause of structural brain maldevelopment, which is autism disorder. But they also have to change how they define autism. You can define.
Well, that's a fascinating point.
An autistic brain. Yeah, anatomically, you can do an MRI on a 3-month-old child and tell whether they have a brain that is consistent with autism. But in the DSM-5, autism is exclusively a behavioral diagnosis. So typically made at the age of 8, when it's way too late. So we have to change how we diagnose this, and we have to look at MRIs and structural brain white matter measurables, which is so easy to see, or relatively easy to see, by a pediatric radiologist. But we have to wait till the child is 8 years old before we diagnose it. And most of the noise you're going to hear is how to treat patients after they already have autism, rather than how to counsel mothers before they get pregnant, and during pregnancy, to avoid or reduce the risk of autism. In 1970, the worldwide rates were 1 in 15,000. Now they're around 1 in 23. 1 in 23 have autism. And it's not because of more diagnosis, not because of genetics. It's because of a massive transformation in the policy of what diets are out there. So yes, that I hope that they make inroads, but I'm very skeptical that they will, because again, if you gather a group of people who have a strong belief that this is what it is, that's what they're going to say. They're not going to have a cognitive transformation to say, well, maybe we're wrong. Maybe we spent $10 billion on trying to find a genetic cause we haven't, but we still believe it's there, we just haven't found it. Or maybe it doesn't exist, and we know it doesn't exist. Or at least there's plausible alternate explanation that does not involve genetics. Tiny fraction may be genetic, but 90+% is not. It's nutrition.
Yeah, fascinating. And again, people can have a look at those chapters in the book, Ketogenic, which is written with you and a number of different authors, expert authors, and that's published by either the Noakes Foundation or the Nutrition Network. I can't remember which.
Correct. Yeah, it's Tim Noakes and the Nutrition Network. Yeah.
Yeah, fascinating. And I'm really, really intrigued with how that developed. I believe it's a really, really good thing that people are talking about it. But again, I echo your points. I hope we don't go with some red herrings and we look at the bigger picture. Data's really, really, really compelling, good quality studies. And a number of them internationally by different universities are showing that insulin resistance and that gestational diabetes, blood sugars, when you have a baby in the womb, and that important pre-conception period are really fundamentally important. And that's really clear in the numbers that if you're obese or have diabetes as a woman, your child is 2 to 4 times more likely to have autism, and if the father is overweight or obese, you're twice as likely to have autism. So we really have a clear connection to insulin resistance, and then lots of other very, very compelling studies on that. So yeah, thank you for your comments on that really interesting, well, not just interesting, but just super important to start getting that right and giving people options and information so that they can make changes. You mentioned we need to get that right before, during pregnancy and before pregnancy, but also that nutrition can help, I believe, in behaviours afterwards as well, after a diagnosis. I've seen that, and I'm sure that you've seen that, and I've heard you comment that we can support people by getting insulin resistance and blood sugars under control, ketosis, getting that brain optimized on those healthy fats that we've discussed, is powerful. It's, if not the most powerful. We're throwing medications and behavioral therapy at something that optimizing the brain it potentially might have the biggest impacts. So there's lots and lots in that area. I want to be really respectful of your time.
Yes, I am a little bit behind
Yes.
right now. I've got to go and do my day
Okay.
job.
So
But, this is, and again, I talk a lot, so I apologize for that. But these are, I believe, important topics that not many folks have insight into, are willing to talk about. And as a practitioner, even though it's difficult to talk about some of these topics, autism, the carnivore diet in our own space, I think it is very important, whether you agree or disagree with me, that we think objectively. My phrase is, I don't care if you agree or disagree with me, if I've made you think, I've done my job. Don't demonize me for how I made you feel about what you're currently doing. Don't demonize me for triggering your emotions. Think about the facts, or maybe if you don't believe it's factual, develop your own set of facts, find your own facts. But your opinion and my opinion may be different, but there's only one set of facts. And that statement comes from Tim Noakes himself, who said, you know what, you may think this way, I may think this way in his trial, but you bring your set of facts, I'll bring mine, and let's compare them. And they couldn't bring any facts. So, again, this is something I've evolved in my thinking based on my observations and based on not believing what I'm seeing for a very long time and questioning it until it couldn't be questioned anymore because it was so truthful. In science, we always assume that we're wrong. Okay? We always have to assume that we're wrong. Otherwise, we believe our own hypothesis and will distort reality. I always believe I'm wrong, and it's the absence of being wrong that most likely makes the thought right.
I like that approach, and I like that you're willing to question and challenge yourself too. But you've definitely given me food for thought during this conversation. It has been invigorating, and a lot of really interesting points on GLP ones, and obesity, the source of obesity, insulin resistance, carnivore diet, controversial thoughts on that. Shouldn't really be that controversial. Really, what you're saying sounds very rational, but I think it will be. But I
It's
do want
controversial
to,
because of special interests.
yeah, and I think we go deep into our silos and we stay there and we get comfortable, but also we associate as a tribe. We become quite comfortable in those, and we don't look up. So I like that, you keep putting your head up there and you're looking around and you're changing course and correcting and giving other people kind of food for thought too. How best do people follow you and get in touch about
Yeah,
potentially the coaching?
I'm Carb Addiction Doc on all social media, and most of my social media has a single phone number that you can WhatsApp to if you live elsewhere. You can leave a message, we'll contact you. The number is +1 if you're WhatsApping, 561-512-0642. Ooh, see, I don't even know what the number is. Let me look it up quickly. Let's see, because everything on social media precludes me from keeping things in my brain.
You've got a lot in your brain.
Yeah, it's Erico. It's +1 561-517-0642, and you can do that from anywhere in the world. Set up a visit with us, And we will opine on who you are and where you are and create a progressive plan of action together with you.
That's
That's the
it.
way we roll.
That's exciting, and you're the first person who's ever left a WhatsApp number. So cool, very cool. And I want to thank you again very much spending this time with me, for all of the information you impart, your research, all of the information you put out there. And yeah, wish you a really good day. Thank you, Dr. Rob Cywes.
Thanks. Have a good evening. Take care.
Take
Bye-bye.
care.
Bye.
Sorry I did go over. I was trying to kind of
No, that's
keep
okay.
to
I
the
do have to jump.
time.
I'm about 15 minutes behind.